Population. The world today has 6.8 billion people. That's headed up to about 9 billion. Now, if we do a really great job on new vaccines, healthcare, reproductive health services, we could lower that by perhaps 10 or 15%.
Something like public health. When we invest in clean energy and electric vehicles and reduce population, more of our children can breathe clean air and drink clean water.
By 2023, we will reduce the number of people in the world by 50%.
We're taking things that are, genetically modified organisms, and we're injecting them in little kids' arms. We just shoot them right into the vein.
What if I told you that some of the most widely accepted beliefs about vaccines are actually the result of powerful marketing campaigns, not pure science? On one side, we have pharmaceutical companies claiming that vaccines have saved millions of lives. On the other, skeptics arguing that the truth is far more complicated. And in the middle, regular people just trying to make the right decision for themselves and their families. Today, we're diving deep into the most common myths, uncovering the manipulative tactics behind the narrative, and asking the question no one seems to be answering: who really benefits? Vaccines are our only protection against deadly diseases. That's what we're told. But let's talk about one of the most powerful tools in advertising: fear. When the 2020 pandemic hit, fear became the ultimate sales pitch. People were desperate for a solution, and Big Pharma delivered. Fast. But what happened next? Their stock prices skyrocketed. Pfizer, Moderna, and Johnson & Johnson made billions almost overnight. Here's the real question: if vaccines were purely about public health, why did these companies push for immunity from lawsuits? The 1986 National Childhood Vaccine Injury Act in the U.S. shielded vaccine manufacturers from legal liability. If their products are completely safe, why did they need legal protection? We've all heard it. Vaccines are rigorously tested and proven safe. But let's break that down. Clinical trials are supposed to ensure a drug is both effective and safe. But what happens when those trials are rushed? The COVID-19 vaccines were developed in record time, skipping long-term studies that typically take years. Even Dr. Robert Malone, one of the scientists involved in the early development of mRNA technology, has raised concerns about the lack of transparency in trial data. And let's not forget, several vaccines have been pulled from the market over the years due to unexpected side effects. So, if vaccines are always safe, why do some end up being recalled? Here's a dirty secret of the pharmaceutical industry. Negative data rarely sees the light of day. Big Pharma has a history of cherry-picking clinical trial results. If a study finds major side effects, it gets buried. If a study confirms their vaccine works, it's plastered all over mainstream media. Take the 2009 swine flu vaccine. It was rushed into production, and within a year, it was linked to narcolepsy in thousands of people. Governments quietly paid out millions in compensation. But did we see a media outcry? Of course not. Numbers don't lie, right? Well, not exactly. When you hear, "This vaccine is 95% effective," what does that really mean? Most people assume it means 95 out of 100 people are protected. But in reality, it refers to relative risk reduction, not absolute risk reduction. For example, let's say you have a 0.2% chance of getting a disease. A vaccine that reduces that risk to 0.1% might be reported as 50% effective. But in absolute terms, your risk barely changed. This kind of statistical manipulation is how pharmaceutical companies make their products seem more effective than they really are. Would you trust a referee who's being paid by one of the teams in a game? That's essentially what's happening between Big Pharma and government health agencies. Regulatory bodies like the FDA and CDC are funded in part by the very companies they're supposed to regulate. The revolving door between the pharmaceutical industry and government agencies means former executives from Pfizer or Moderna end up making vaccine policy decisions. This isn't a conspiracy, it's public record. And yet, we're expected to believe that vaccine recommendations are completely unbiased? Ever notice how anyone questioning vaccine safety is immediately labeled anti-science? That's not an accident. It's a tactic. The term anti-vaxxer was popularized to discredit anyone who asks questions. Even if someone is fully vaccinated but expresses concern over side effects, they're lumped into the same category as conspiracy theorists. This creates an environment where people are too afraid to speak up. But here's the thing. Science depends on skepticism. If we stop questioning, we stop progressing. Big Pharma spends billions on advertising. Just turn on any major news network and you'll see drug commercials on repeat. Think about this. If a news station is being paid millions by Pfizer for ad space, are they going to run a hard-hitting expose on vaccine side effects? Of course not. That's why independent journalists and researchers have to dig through medical records and whistleblower testimonies to get the truth out. Because mainstream media, they're not biting the hand that feeds them. Doctors who speak out against vaccine policies risk losing their medical licenses. Scientists who publish studies challenging vaccine efficacy get blacklisted. Just look at Dr. Peter McCullough, a renowned cardiologist who questioned certain aspects of the COVID-19 response. Despite his credentials, he was immediately attacked and labeled a conspiracy theorist. This isn't about science anymore. It's about control, because if you silence enough people, you don't have to defend your argument. So what's the takeaway? Vaccines aren't inherently bad, but blind trust in pharmaceutical companies? That's dangerous. We have a right to ask questions. We have a right to demand transparency. And most importantly, we have a right to make informed decisions about our own health. The next time you hear a sweeping statement like vaccines are safe and effective, don't just accept it. Dig deeper. Because when trillions of dollars are at stake, the truth is often the first casualty. We're building a community of free thinkers who question, learn, and break free from the system. If this video sparks something in you, help us make this community even stronger. Subscribe and be part of a movement that pushes for real change.